Hello everyone. Today Dr. Gaurav Sharma, consultant urologist from Anaya Urine Gynae Care in Kamranagar. Today the topic of discussion is overactive bladder. First topic of discussion is should know what is overactive bladder. So the patient's complaints of sudden urge to urinate, that is urgency associated with frequency and nighttime frequency, is called overactive bladder without any obvious cause. So it is more common in females and it is of two types. Wet means it is associated with incontinence, means sudden urge or to pass urine along with wetness of the clothes. And another is dry. So dry is more common in men and wet is more common in females. And 40% of the patients of overactive bladder presented with the incontinence of the urine. So another part of examination is cystoscopy, urodynamic study and ultrasound. These are the specialized investigation which is not usually included in the uncomplicated patients. These investigations are offered for the patients with overactive bladder with severity or complicated overactive bladder. Now come to the treatment of this condition, which includes first the dietary modification, in which we modify the time of intake of the water, and another part is doing some exercise to reduce the weight, and some type of food we have to avoid in this condition, which includes the excessive sweeteners, excessive sour foods, and chocolates, nuts, and excessive water intake in the evening hours. So second part is pelvic floor exercises, in which we increase the tone of the pelvic floor muscles to control the mentioned symptoms of this condition. Third part is the medical treatment, in which we offer the anticholinergic drugs to decrease the involuntary contractions of the muscles, which includes the sulfasalazine, mirabegron, and the combination of both the drugs. Other part of treatment is partly surgical, which includes the Botox injection to the bladder muscle, neuromodulation of the sacral nerves, PU nerve stimulations, and the management of the complications associated with the overactive bladder, like in some patients presented with the decreased capacity of the bladder. So in such conditions we offer the surgery like augmentation cystoplasty, and sometimes some patients require the excision of the bladder wall of the bladder, which is called cystectomy followed by diversion. Thank you.